Hi, my name is Kyle, and I'm a bladder cancer survivor. This is the 7th in a series of videos where I discuss my experience with bladder cancer and its treatment. In this video, I talk about the surgery to remove my bladder and my prostate and to construct a new neobladder. The radical cystectomy, or complete removal of the urinary bladder, is the gold standard of treatment for muscle-invasive bladder cancer, so that's anything stage 2 or above. In my case, I also had my prostate removed. I think that's typical, given the prostate's proximity to the bladder and the likelihood of it also getting cancerous. There are 3 typical urinary diversions that are used after removing the bladder. There's the allele conduit, the Indiana pouch, and what I chose, the neobladder. All of these are different operations, and they have different recovery times and different recoveries in general. This video discusses my neobladder surgery recovery. The neobladder is constructed using a piece of a large piece of small intestine. So the prep for the surgery is kind of similar to what you have for a colonoscopy, except in my case it wasn't as intense. So the day before the surgery, I wasn't allowed to have any food at all. Starting midnight, like 2 days before. So no food, only clear liquids, and I had to drink a bottle of magnesium citrate, which is a laxative, and then take multiple laxatives throughout the day, with the goal of clearing out my intestines, so that when they cut a piece of intestine out, it would be clear. The day of surgery, my surgery was scheduled for very early in the morning. I think I arrived at around 5:30, and my surgery time was around 7, I think. It's a very long procedure. The procedure itself, I think, is about 7 hours. My wife said I was out for about 7 or 8 hours. I woke up in the progressive care unit, the PCU. I had several incisions and tubes and IVs. I had the Foley catheter, which is a catheter going into my penis. I had a suprapubic tube, or SPT, on my right side. It's a large tube going into an open incision. I had a kidney stent that went to my right kidney. That's a small tube that exited out the same hole as the SPT. You couldn't see them, but I had 2 stents in my left ureter to keep the ureter open and keep the kidney functioning. I had a JP drain on my left side, which is a small tube going into an open incision that ends in a plastic ball. It's fist-sized, about, and it just kind of hangs via a small tube. It collects fluid. I had a large incision from my belly button to my pubic bone. I had 2 about ½ inch smaller incisions to the left and right of my belly button. I had a nasal cannula that was monitoring my breathing going into my nose. And I think when I woke up, I had an IV going to each hand. So it was a lot of tubes. I spent, the first half of my stay in the hospital just making sure my tubes weren't tangled and keeping things organized, and just trying to find a way to organize them that they wouldn't get pulled. My wife said when I woke up that first day I was pretty much in a haze. I think I had some visitors, but I wasn't really coherent. The first day when I woke up, I couldn't have any, certainly no food, and not even any fluids. I eventually convinced them to give me some mouth swabs that I could dip in water and wipe around the inside of my mouth to keep my mouth from drying up so much, because when I first woke up it was completely dry and really uncomfortable. But I couldn't drink any of that fluid. It was just to keep my mouth moist. And I think because of all the tubes and because of the anesthesia and just my mind racing so much, I didn't sleep at all that first night or that first day when I woke up. So the second day, I was able to stand up and move across the room to a chair. I did that a couple times. I wasn't able to walk any farther than that chair due to muscle pain and nausea. They had me on hydromorphone, which helped with the pain of the incisions, but it didn't touch the muscle pain. So I had my bladder and my prostate removed via robotic surgery, and I had my neobladder, I think my intestine and my cut and resected, and my neobladder constructed using open surgery. So I had a large incision that had to cut through my stomach muscles, a vertical incision. So the pain medication that they had me on was a pain button that I could activate myself. That pain medication helped with the pain of the incisions, the surface pain, but it didn't help the pain that I had in the muscle from where it was cut. And the incision pain really wasn't that bad. It was the most of the pain I had was that muscle pain. So anytime that those muscles contracted, whether it was because I turned in bed or I tried to sit up in bed, or even if somebody just brushed against my belly, and I reflexively kind of flexed those muscles, that kind of contraction would cause my belly to hurt a lot. If I laughed or gosh, if I coughed. I don't think I coughed for a few days, luckily. Laughed or coughed or sneezed, that would really hurt. And the medication really didn't touch that. But it wasn't horribly bad as long as I didn't move around too much. By the end of the day, they gave me ice chips, which was nice, so I could get some fluid, and I had something to chew on. Since I hadn't slept the night before, they gave me Restorol to try to help me sleep, and that didn't have any effect on me. So they gave me, in the middle of the night when it wasn't working, they gave me Benadryl, and that actually caused me to nap a little bit and get just a little bit of sleep. So that was good. The third day, post-op, I had my first walk, so I got up out of bed and I walked to the nurse's station. I had a physical therapist with me during that first walk, and it felt fine, but the therapist didn't want me to walk too far, so we just walked kind of across the hall and back. The second walk I went on that day, I used a walker, and I was able to do a whole lap of the PCU. After I was up and kind of walking around, they let me have a popsicle, and whether it was because I hadn't had anything to eat or any kind of flavor in several days, or I don't know if the anesthetic was causing me to taste things weirdly, but I didn't like the popsicle and I really just went back to ice chips. I wasn't really hungry, surprisingly, because I hadn't eaten in 3 or 4 days. I was mostly just pretty messed up from lack of sleep, because I hadn't slept in so long. So that night they gave me Ambien, and the Ambien put me to sleep, but it gave me really crazy dreams, and I didn't wake up feeling very rested. So if you have trouble sleeping, I personally just prefer Benadryl. The Benadryl they give you via an IV is different than what you take over the counter, and for me at least, it really puts me to sleep. Day 4, I got up and walked 3 times, and each one of those times I took 2 laps around the PCU with a walker. By that time I was really just using the walker to hold all of the tubes and bags that I had, so and the IVs. So the SPT has a drainage bag, a large bag. The Foley catheter has another drainage bag just like it. The kidney stent had, in my case, was a plastic container, about the same size as those large drainage bags. And then at any point in time, I had a couple IVs and my pain medication. So the walker helped hold all that stuff, but I really didn't need it for support. As I got up and walked more, it got easier to get out of bed. I didn't hurt as much. And in fact, if I went too long without getting up, my muscles started to get tense, and they would hurt more. So I tried to get up as often as I could. And since it hurt sometimes, I asked my doctor if I was going to tear anything, because I didn't want to tear, my external incisions or any of the number of internal incisions that I had. So I asked him if the pain was a sign of something about to tear, and he said no, it's just, you're not going to tear anything. So I just kind of played with the pain and tried to ignore it and just walked as much as I could, because one of the key pieces of advice that I got from people on BCAN is to walk all that you can. And that's the same thing the doctor has told me, was the best thing you can do is get up and be active and walk, because it helps your muscles recover, and it also helps get your bowels moving again, because I had been under general anesthesia for probably 7 hours. So I've heard people say that each hour you're under is like takes a day for you to recover from each hour you're under general anesthesia. So I had to get up and move to get my bowels moving, to allow me to be able to eat, because they won't let you eat anything until you at least pass gas and hopefully have a bowel movement. So it was getting easier for me to get out of bed, and I was walking a lot more by that day 4. So because of that, they started letting me have a liquid diet, clear liquids only. So I could have like juice. Unfortunately, drinking that juice caused me to have surprisingly a lot of bloating. So I started to get a lot of gas, whether it was because I was drinking juice now or if it was just natural. I was starting to get really bloated, so I went really slow on drinking, and I kind of just stuck to ice chips and just used the juice for a little bit of flavor every now and then. That day they moved me out of the PCU and I went to the normal recovery unit. I had bad gas pain all evening and all night, and I didn't sleep because of that. they started putting me on pills to reduce my stomach acid and to stimulate my bowels, and they gave me a suppository to also help stimulate my bowels. But it was that day, the 4th day, when I started to get gas pain. On the 5th day, I had really bad gas pain in the morning, and I hadn't slept all that night. Hadn't slept at all that night because of it, and I was starting to get really discouraged because I was trying so hard to be active, but I wasn't able to be active to wake up my bowels. But I wasn't able to pass any gas, even though I was trying so hard. So I was laying in bed, feeling sorry for myself, really early in the morning, and the physical therapist came in, as she did every day, and she asked me how I was doing, and I said horrible. And she said, "Well, are you ready to walk?" And yeah, I'm ready to walk. Really, whenever I started feeling bad, I would get up and walk. I would walk normally when I wasn't feeling bad, but especially when I was feeling bad, I'd get up and walk. So it's kind of counterintuitive. Normally I think when I'm feeling bad, I want to lay in bed, but in this case, whenever I felt bad, it motivated me to get up and walk. And more often than not, just getting up and moving helped me feel better. And in this case, it helped me feel a lot better because it was during that walk in the morning with the therapist that I started to feel like maybe I could pass some gas. So I ran back to the bathroom and was able to. So I felt a lot better after that, both physically and mentally. I walked a lot more that day, I think twice more, and each one of those walks was 2 laps. I was trying to walk at my normal walking speed, which is pretty fast, just to make sure I was giving myself a pretty good workout. And I was able to pass a lot more gas after walking so much, and that was great. That day, on the 5th day, I stopped using the pain medication, and once I stopped using that, they were able to take the nasal cannula off, and that was wonderful. That's, out of all the tubes that I had in the hospital, that was the most uncomfortable, just because it sits on your lip, and it collects moisture there when you breathe, and it sits on your cheeks, so it's always hanging off your face, and it's really annoying. So it was worth not having those pain meds just to get that thing off my face. And honestly, the pain meds weren't helping much anyway, and I wasn't in that much pain to begin with. By day 5, I wasn't really hurting too much unless I did something really wrong, if I twisted the wrong way or tried to do a sit-up or something. Since I was passing gas really well and walking a lot, they allowed me to have solid food for dinner that night. I had a lot of restrictions. I wasn't allowed to have any high fiber or anything that had a lot of a lot of residue. I couldn't have anything with seeds or nuts because those could get lodged in the incisions in my small intestine. So they let me have, aside from those restrictions, I could eat what I wanted, and I assume as much as I wanted, but I purposely took it really slow. In fact, I started out with just like pureed soup for lunch, and then I had, I forget what I had for dinner, but it wasn't very much. I didn't eat very much at all because I didn't want to. I didn't want to get any more gas pain than what I already had, and I wanted to make sure I didn't build up a lot of stool and get constipated, because it's really hard. Number one, when you have a Foley, at least in my experience, it's difficult to push because some urine seeps out and it burns if you push too much. And then number two, with the incisions in my intestine and definitely the incisions in my stomach muscles, I didn't want to get constipated because it would hurt too much to push. So I went really slow with the food, and I'm glad I did. So on day 6, I still had pretty bad gas pain overnight, so much so that I couldn't even try to sleep. I would lay in bed, and then every couple hours I'd wake my wife up to go take a walk with me. So I spent the entire day and the entire night just walking. And that helped me pass some more gas, and that helped a lot. I think I walked, I don't know how many times I walked overnight, but I took 5 walks during the day that day. Each one of those was a couple laps, and I was walking really fast each time, just to give myself a good workout. On day 7, I was discharged. So I'd been there a week, and they finally discharged me. I'd been up walking so much that it didn't hurt to get up and get dressed. I wore some special pants from a company called Ronwear. They're made for people with chemo ports. They have both jackets and pants, and they have zippers in both the jackets and the pants that allow access to your legs and your collarbone where your port would be. And I use those pants to route my catheter tubing and my stent tubing. So I was able to wear normal looking pants, and I've got all these tubes hanging out of a zippered hole in the pants. I'll put a link to the company and in the comments. But they're nice pants. They worked out really well for the catheters. It didn't hurt too much to get into the car, but once I put the seatbelt on, the lap belt would hurt pretty bad anytime that we went over a speed bump or any kind of pothole or anything. And even just like any kind of acceleration, whether speeding up or slowing down or even turning, caused just a little bit of pressure on my lap, and that was enough to make it hurt. So I put a pillow between my lap belt and my abdomen, and that helped a lot. So I was in the hospital for a week, and I definitely learned some lessons while I was in there. I think the most important thing is you got to get up and walk. The doctors told me that, and other patients that I talked to told me that, and it certainly worked for me. Number one, it made me feel better. Made my muscles feel better. Number two, it woke my bowels up faster, which got me the ability to eat. They would finally give me food when I started passing gas, and it also made me, and more importantly, feel a lot better, because the gas pain was the worst pain that I had during the recovery. So anything you can do to reduce that is good. Along those lines, even once they release you to be able to eat food, definitely take it slow, because the gas pain can get really bad, and you don't want to let that build up too much, and you certainly don't want to get constipated or blocked up. I think it's important when you're recovering in the hospital that you have somebody there to be your advocate. Normally I say be your own advocate, and I think you have to a certain extent, but I wasn't able to. I was messed up enough in the first few days that I wasn't able to recognize that I needed certain things done for me. Like the nurse just happened to notice that I was always awake. Every time she'd come in, day or night, I was always awake, and I just wasn't sleeping. And it took her a while to convince me that I needed to take some kind of drugs to help me sleep. I would have never asked for that, and I probably wouldn't have realized how much it was affecting me that I wasn't sleeping. So have somebody there who can be your advocate, whether it's a loved one that's staying with you, or a conscientious nurse, or if you can do it yourself. And to a certain extent, you have to be your own advocate, because you have to motivate yourself to stay active, to get up and walk. I would set goals for myself, and I'd write them on the whiteboard. My bed was always facing the whiteboard on the wall with my chart information. So I'd put check boxes on the board that today I'm going to walk 6 times. And every time I get back in the room from walking, I'd check that box. And I was always showing off to the nurses how many times I walked today. And telling people who would come to see me, hey, you got to go on a walk with me, because I've got to walk 6 times today. So set your own goals and motivate yourself, because that's your job. Your job is to get better. I mentioned the JP drain that fills with fluid. That gets pretty heavy when it fills up. And I wasn't allowed to empty it myself. They had to chart. The nurses had to chart how much fluid was in there. So it gets heavy and it hangs freely from an open incision. So I pinned mine with a safety pin to my gown. There was a little tag hanging off it that allowed you to do that. So by pinning it to my gown, it reduced the amount that the drain was pulling on the incision. That helped a lot. I think at least my JP drain was filling up a lot more than the nurses expected it to. So they would come in, and the PCU, I think they came in every hour, and in the normal ward, I think they came in every 2 hours. But that JP drain would fill up pretty much every hour. And they didn't always check it when they came around for rounds. So I would have to keep an eye on it myself and let them know when it was full and needed to be drained. Because once it fills up, it doesn't pull any more fluid out of your body. And that's stuff that you want to get out. I think it's supposed to be pulling out peritoneum fluid, but I think mine was filling up with urine, because my new bladder hadn't healed shut yet, so I think it was leaking. So you want to get that stuff out to avoid infection and sepsis. So I would keep an eye on it and let the nurses know when it was full, and they'd come in and drain it if they hadn't done so already. I think the big things are walk a lot, and stay active. And when you feel bad, walk. And when you don't feel bad, walk. That's probably the most important. And then I think the second most important is go really easy on the food. Even when they clear you to eat what you want, go easy until you know you're going to react well to it, because you don't want to get blocked up.